As coronavirus spreads in the United States, the nation's testing capabilities are not keeping pace. Tonight, the largest union of registered nurses, National Nurses United, is raising alarms that members of their union are being denied testing after potentially contracting coronavirus from infected patients. Joining me now is Bonnie Castillo, a registered nurse and executive director of National Nurses United. Ms. Castillo, you have a member who wrote a letter today, and I wondered if you can give the context for that letter.
Yes, we do. We have over 80 registered nurses under quarantine, and that list is growing daily. And we had a nurse who wanted to express her experience and convey her concern with regards to the bureaucracy of the testing and the fact that she has not been able to get testing despite having cared for a positive patient.
I'm wondering if you could actually just read that letter, because I found it really powerful. Would that be all right?
Yes. So this is a statement from the quarantine nurse from a Northern California facility. As a nurse, I'm very concerned that not enough is being done to stop the spread of coronavirus. I know because I am currently sick and under quarantine after caring for a patient who tested positive. I'm waiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered it. I volunteered to be on the care team for this patient who we knew was positive. I did this because I had all the recommended protective gear and training from my employer. I did this assuming that if something happened to me, of course, I too would be cared for. Then, what was a small concern after a few days of caring for this patient became my reality. I became sick. When employee health told me that my fever and other symptoms fit the criteria for potential coronavirus, I was put on a 14-day quarantine. Since that criteria was met, the testing would be done. My doctor ordered the test through the county. The public county officer called me and verified my symptoms and agreed with testing. But the national CDC would not initiate testing. They said that they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus. What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of our country's health.